Hi, everyone. So when I was asked to be on this panel, I felt like a lot of what I needed to talk about was more about how abortion access intersects with a lot of other movement work. I feel like it's not a hard sell to talk about why abortion access should be reproductive justice, right? I mean, I think that that's not something that anyone is arguing with here. So the session that we were in was fabulous. It was so awesome to have so many people in one room, really talking about their different experiences with access, and a lot of them were on the front lines of that work. We had a lot of clinic workers, and we had a lot of people who were at abortion funds, and I feel like those are really the front lines of what's going on with abortion access in the United States, and that was really exciting. So I'm gonna start with a story, because apparently I like telling all my stories today. But I feel like this story is kind of exciting because it is about my first time really doing abortion access activism. And so I was 18 or 19 and I was living in Richmond, Virginia, and I noticed with a couple of my friends that we were having protesters at clinics. And at that point, we didn't have a clinic escorting program going on. And so we decided, well, we're going to do that. Of course, we also felt like we invented it. As I expressed in my last session, I felt like everything that I've done, I invented. Thanks for Google, I know that that's not true. But so we all got together, we made our signs, we were very excited. They said pro-choice, they were really big and yellow, and they were so great. And we went to the clinic, and we stood there. Oh, I didn't start my timer either. Okay, sorry. So we went to the clinic and we were holding our signs and we were so excited. We were like, we are doing this. Like, we are the movement. We are getting women into this clinic. You know, it was like nothing like you see in like, you know, the past, but you know, whatever. They were still there. And so we're holding our signs, and I remember standing there and we were excited. And I remember the first person coming into the clinic, and I remember rounding the corner, and I remember seeing in her face just anxiety, panic, and why am I dealing with this? This is so confusing. Like, why are people even here? Like, I don't understand what's happening. And I remember that when she looked at me, that panic didn't go away. And I really didn't understand that. Like, I'm here to help you. Like, don't you get that? Like, I'm here to help you. And I remember saying to her, I'm pro-choice. I'm here to help you. And she looked at me like, what are you talking about, you know? And I was like, I'm with the clinic, and I'm here to help you. I can help you get into the clinic. And I remember in that moment, it clicked. That this is not something that is every day. This is not something that people talk about every day. And I think that that's really important when we talk about access. And tell this story because I think often we don't realize that access is more than just talking about rights and logistics, right? It's about how we operate in our own movements. What language we use and whose stories are validated by our political frameworks and ideologies. And we see that a lot in the pro-choice movement, right? If the people who are having abortions can't relate to the way we politically frame abortion, something isn't lining up. And we know that the truth of the matter is that most people don't feel like abortion is a choice usually. It's an exhaustive solution that may feel like the only option at that time. As a clinic worker, I can't tell you how many times I heard from people, I do not have a choice. Stop telling me that I have a choice. This is what I have to do to survive. And I think that when we erase that from people, we're erasing a lot of the truth. When we have this false binary of you either really, really want your baby or you really, really don't, we lose a lot of people in the middle who don't fall into either of those categories. I also tell this story as a reminder of how even with the best intentions, people can make mistakes in this work, and how easy privilege gets wrapped up into our every move, and how important it is for those who are most affected to be doing the talking, and for those who are not the most affected to really do some listening. And when I say listening, I mean active, participatory listening. And as a 19-year-old outside of a clinic, it was a good awakening for me, and I've carried that with me since then. So one of the things that I do is I work with a national network of abortion funds. So we work with people all across the United States and a couple of international funds to really build up grassroots groups to be able to serve people when they need abortions. And we do that in a lot of different ways. We do that in money, and we also do that in transportation and lodging and all sorts of really awesome things. And we talked a lot about those different things that are needed and already happening in our session today. And I just want to kind of talk about a few of those things because I thought that they were really great. So a lot of what we talked about was stories, and how stories are really, really powerful, and how sometimes that's the way to talk to people who are in that middle ground, right? It's really hard to demonize someone who you know and love who's had an abortion, and let's be real, if 1 in 3 women is having an abortion, there's someone you love who's had one. And that's something that we don't really talk about all the time. And that's a really great way to kind of get in there without talking about statistics. And this is, do you know that this is how many women in your community are having abortions? And I think that's something that we really need to think about a little bit more. We also talked a lot about the international work that was happening, and especially in the Global South, and how there's a lot of really amazing organizing that's happening down there, and we should be listening, and we should be seeing what they're doing and seeing how we can use that in our own movement. And I felt really inspired by that too, because I think oftentimes it's really easy when you're in the United States and it just feels like time after time after time. I mean, I'm in Virginia. This was a really tough legislative session for us. It felt like we were just getting beat up over and over and over again. But it's really inspiring to know that just down south in Mexico, there's amazing work that happened. That happened, and they did amazing work that was a grassroots effort. And I think that that's something that we really need to carry with us in our own work. That grassroots work. It's how things change, and that's why us all being in this room is so important. So I just want to say that it's also not just about abortion, right? So as someone who has answered the hotline for abortion funds, I know that most of the people who call, it's not just one thing that they're going through, right? It's not uncommon for us to hear, I'm homeless, I don't have a job, I have 3 children, and I don't know what to do. That's not uncommon. It's a lot more common than you think it would be. And so we know that we can offer a service at that moment that could potentially help shape that person's life, but that is not going to change their life forever. There are still a lot of things going on there that have to be addressed, and that's why it's important that we work with other movements and that we don't silo ourselves in thinking that we are saving the world when we are doing abortion funding. It is great work. I'm very proud to be a part of it, but we have to work together if we're going to be able to really kick ass. Because we do live in a world where we are not guaranteed a living wage, a place to live, and comprehensive health care. And because of that, our work is never going to be done, but it's not just about economic justice. The network does come from a place of, we do believe that our work is economic justice just as much as it is reproductive justice. And I think that that's very true when you're talking about dollars and cents to be able to get an actual procedure. But we also know that it goes a lot deeper than that. It's about mothers knowing that their children will be born into a world where brown lives are not valued. We see that all the time. We know that you do not know, it's more likely that your son will go to prison than to graduate high school in a lot of areas. A society where poor families live in areas where toxins are pumped into their rivers, contaminating drinking water that makes them sick. A community that regulates its interpersonal violence with state-sanctioned violence or doesn't regulate it at all. Those are the realities for people when they're thinking about, am I going to have another child? Am I able to have another child at this moment? And when we say it's a choice, that erases all of that. So we have not made all these changes in the world yet, but someday I hope we do. And I don't think that we would be in this room today, this room today if we didn't think that another world was possible. So we are actively all working together in so many different ways to chip away at that oppression, and I think that it's important for us to remember that while we're feeling like it's small chips, when it's so many chips going at the same thing, we're really going to be powerful. So in the meantime, it is in my opinion, since our government has created a society where we do not have real choices in our everyday life, that they damn well better pay for our abortions. And while repealing the Hyde Amendment was the landmark legislative decision to strip Medicaid funding from poor women having abortions is a good start, and something that we are working very hard on, and we invite you all into that fight with us. We know that this is only the first step onto the long road to true reproductive freedom and happy lives. Woo.